It has been over 30 years since the first case of AIDS was reported in Uganda at Kadisizo Hospital. According to Uganda AIDS Commission, at that time there was no treatment available and an AIDS diagnosis was considered a death sentence. Many lives were lost. Today, the Uganda AIDS Commission and its partners observe the candlelight memorial in memory of those who have lost their lives to AIDS and recommit to collective efforts to end HIV/AIDS by 2030. The key messages conveyed were the importance of zero discrimination and stigma, zero AIDS-related death, and zero new infections by 2030.
And another reason for focusing on new infection is that the route that leads to HIV infections is the same route for other undesirable health and development outcomes. It's the same route for other diseases. It's the same route for early pregnancies, which is so devastating to both the young mothers, their children, and to all of us in the broader society.
While the Ministry of Health acknowledged the progress that has been made, they emphasized the need to address the issue of children born with HIV, as it is a significant concern.
Annual number of children born with HIV from 20,000 in 2010 to 5,000 to 6,000 today. It's an achievement, but having 6,000 children who are living with HIV, there is nothing much to celebrate.
State Minister for Health in charge of general duties, Anifa Kawooya, has urged stakeholders not to cut funds allocated to HIV response.
We may have cut funds anywhere. You may cut funds in my dressing and my makeup, but let's not cut funds for the people living with HIV to access the drugs. I appeal to each and everybody, our strong cooperation in this area to continue, and we work together.
Religious leaders have recognized the importance of addressing stigma and have called for increased local funding for HIV response.
Reduced global financing of HIV and AIDS response and the lack of locally owned financing mechanisms continue to pose a serious threat to our response to this scourge.
The Vice President Jessica Alupo, represented by the Minister of Kampala, Misa Kabanda, has directed media houses to air HIV messages.
The Ministry for Information Technology, Communication Technology and National Guidance should come in support of this directive. The Ministry of Finance, Planning and Economic Development to put in place a strategy where all sectors allocate a percentage of their budget for HIV and AIDS activities.
As per Uganda AIDS Commission data, an estimated 1.4 million people are living with HIV, and last year Uganda registered 54,000 new infections. Nobat at Kunda, NTV News.